Welcome to Hardamil Dental Clinic. My name is Christian Mill, and with this small presentation we show you how we repair damaged teeth with partial crowns. This is the initial situation of a patient who damaged his teeth severely due to a very high consumption of very acidic food, for example apples, pear, and drank roughly between 1.5 and 2 liters of cola each day, and additionally with a heavy grinder. So what we had to do, we had to replace the missing tooth substance. You can see here from the left side to the right side how exactly we did it. First, which you can do, you don't have to do, you can do that. You just paint the teeth black so you know exactly how much and where you take away things, and then you indicate with a depth burr how exactly far you want to go, indicated here by the blue line on the teeth, and then you just prepare the teeth. With partial crowns you try only to replace the substance which is really missing. So you only take away things which are really missing or need replacement. So you can see here after the preparation we took the impression. Of course, after the impression you have to take a bite in order for the technician to know exactly how the upper jaw fits to the lower jaw, so that the new crowns or partial crowns are exactly made in the position the patient needs them to be. And of course, after the preparation and the impression you need to produce a temporary, ideally after a so-called wax up that is a simulation of the final work. And you can see here indicated by the lines, or indicated by the lines, you see the cement which was used to cement the temporary. And you can see the rest of the tooth substance, for example on the left and on the right, which will not be touched. So just the little bit lighter part will be replaced with ceramic later on. The color in that case does not fit yet because we only have certain shades of temporary material for the production of the provisional situation. In the next session we take the color, which you can take in the impression session as well, and take pictures so that the technician not only knows the shape of the teeth and the bite, but also the color which he has to reproduce. And you can see in the top line these are full metal ceramic crown, that means metal framework, fully veneered with ceramic. And on the lower part you see so-called veneers or partial crowns for the front teeth. And they can vary massively in shape and form according to how the patient needs it and wants it with regards to aesthetics. So the top line is for replacing the back teeth because they have been so severely damaged that we cannot place partial crowns, and the lower part is for replacing the tooth substance for the front teeth. And here you can see partial crowns. You can see they don't circumference the tooth entirely, they just replace missing or broken or decayed parts of the tooth. And normally they're made nowadays with pressable or milled ceramics. And you can see here the situation where we're about to place our place our veneers and partial crowns into the patient. And you can see that we really only prepared the teeth where they had to be replaced, or where the tooth substance had to be replaced. The blue thing you see covering the rest of the soft tissue is a so-called rubber dam. A rubber dam increases the quality of the bond between the ceramic and the tooth by roughly 30%. So it's vital that we use it when we place partial crowns adhesively. And then in this situation we placed every crown, every partial crown, every veneer bit by bit. You can see here on the left side the first place crown, and on the right side the tooth is very shiny and milky. This tooth has been etched with phosphoric acid to create a very rough surface so that the crown really bonds onto the tooth. And you can see here then by the yellow arrow indicating where full crowns will be placed, the blue arrow where partial crowns will be placed, and the green arrow where veneers or nearly full crowns has been placed. So, and you can see the soft tissue is very healthy, only smaller inflammations, which you can see in the middle picture on the small right tooth. There's a small inflammation, but that is all no problem for the patient. You can see here the final situation where the back teeth have been repaired with full crowns, then the smaller teeth, slowly coming towards the front, have been replaced with partial crowns. Here you can see this the situation more in detail in a different patient, but the technique more in detail. You can see the preparation is just oriented itself on the defects. So you just prepare the tooth material way where you have the defect. Then you place the crown, you bond it, you glue it directly into the tooth with special cements. And then you have here the final situation directly after placing the final partial crowns. And these last up to 20-30 years. Thank you very much for your kind attention.